Good morning, good afternoon, good evening, wherever you are. Welcome to Cities Hub case study event. And I'm really glad to welcome Amanda Pomeroy-Stevens here with us today from JSI, who's going to show us a case study around creating healthier, more resilient cities. Hopefully everybody's here at the right link. And there's a couple of other systems innovation events taking place around the same time. So I'm going to give you a few seconds just in case you have clicked on the wrong link, and to make sure that you are in the right place or not. Hopefully the title seems familiar and you're here in the right place. But it doesn't matter, you can always stay with us, even if you are in the wrong place. I'm sure that today's will definitely be a better presentation than the others going on, I'm sure of it. Just a bit of healthy competition. So I wanted to introduce you, first of all, to my colleague, Anya, who's also co-hosting today's session. She's new to the Cities Core team. So Anya, would you like to say hello to everybody?
Hello, welcome to this exciting event where we will definitely learn a lot from Amanda. I'm happy to be your co-host.
Thank you, Anya. So today's session is being recorded as well. So if anybody is having any technical issues or is having to kind of dip out before the hour is up, you will be able to catch up with us. And once it's all done, we'll be able to share the link with you in the Systems Innovation Cities Hub channel. You'll be able to catch up with us then. So I just wanted to give you a quick overview of today's agenda. So some welcome introductions. I think I've nearly used up my 3 minutes for that. So once that's over and done with, we're going to have a quick check-in with everybody here. I've got a quick question to ask you, and encourage you to kind of respond to that in the chat, just giving us a bit of a quick update as to where everybody's at today, and why they're here. And then quickly into the presentation from Amanda. We've kind of penciled in for 30 minutes for that case study presentation, and the idea is to get plenty of time afterwards for some question and answer, where we can kind of ask and probe some of the themes that Amanda has presented during the 30-minute case study. And then that 15 minutes, I'm sure, will fly by very quickly, and then a quick 5-minute kind of community checkout at the end. So I'm going to kind of push on. I think that 3 minutes is up. I know that people are still joining, but for those of you that are here, I have a quick question for you. So, where are you from? So where are you based today? It's always nice to kind of get a feel for where people are dialing in from. So do say hello in the chat, but also, why are you here? What is it that kind of attracted you to this particular case study or this particular presentation today? Yeah, just give us a bit of an idea as to why you were so attracted to hear Amanda talk about co-creation and building healthier cities. Munich, Berlin, excellent. Thank you. Tokyo, wow. I'm guessing quite late in Tokyo. Or very early, whichever way you're looking at it. Very late. Thank you for joining us. Los Angeles. Amanda was just saying about kind of, she was happy to be on the East Coast. So in some of the very early morning calls. I want to hear about engaging citizens. Fantastic. Thank you, Crystal. A partner with JSI on the call as well. Thank you, Paul. Creating edible parks. That sounds amazing. Thank you, Wen. Edible parks. Oh, that's exciting. Definitely want to know more about that one. Yeah. Just as mentioned about kind of understanding, kind of good, what does good look like in co-designing and developing city spaces? So yeah, co-designing is it's something which an awful lot of people talk an awful lot about in terms of co-design, co-production, collaboration, etc. Yeah, so it'd be interesting to kind of see a really good case study of how it's done and how it aids that transition from one system to another. Fantastic. The person from California. Oh, it's good to see such an international crowd. Well, a huge thank you from me for joining here today. So yeah, so please do keep kind of responding into the chat there, telling us where you're from and also why you're here. What is it that you wanted to learn from today's discussion and today's case study? But it is my absolute pleasure to invite Amanda to come and say hello and to share her case study with us today. I'll tell you what, I'm going to kind of give a bit of a lengthy spiel to kind of introduce Amanda, but I think it's better if Amanda talks for herself rather than kind of me speak on her behalf. So it would be absolutely wonderful, Amanda, if you could unmute yourself and give yourself a bit of an introduction about you and your work. And then I'll hand over to yourself to share your screen and kickstart the presentation.
Okay. Thank you, Carl and Anya, for hosting us today. I'm excited to be able to talk about our work to this larger, newer audience to us. So I am project director and research lead for a new project, Asia Resilient Cities, which I'll touch on at the end of the presentation. But for the last 5 years, I was leading Building Healthy Cities for USAID as our funder at JSI. John Snow Inc. is an international public health organization. We also have work in education and supply chains and fragile settings, work across about 80 different countries. I am based in the US. I've been with JSI for about 12 years. My background, I'm an applied economist by training, and my background is primarily in research, but I've sort of backed into project leadership through these research and learning projects under the Asia Bureau, which have been a really nice way to test out applied research approaches where we're implementing and researching in tandem and using the research to adapt the implementation, which is, I know how some projects are supposed to be done, but very often with these large projects, simply because of manpower, they end up being very separate and you don't get to have that interaction. So it's been a very fun process. So I'm gonna, should I jump into the presentation, switch presenting?
No,
okay.
Yeah, I'll stop sharing my screen and you can switch to your presentation. Thank you, Amanda. Yeah, really looking forward to this. So yeah, please do make sure that everybody's on mute when Amanda is talking. That would be fantastic. Thank you very much. If you've got any questions whatsoever as Amanda's talking, do feel free to put them into the chat. We'll revisit them after the presentation. Or just make a note of them, and then when we go through the Q&A, you can pop them in there and we'll be able to pick them up. But between Anya and I, we'll keep an eye on the chat as we go. So yeah, welcome, Amanda. Thank you very much.
Thanks. So as I say, starting with Building Healthy Cities, this is a 5-year project funded by the Asia Bureau. So our 4 cities that were partners were all in the Asia region. These were all secondary cities, meaning they were between 1 and 4 million population, but growing rapidly. So we wanted to sort of partner with them as they're on their way up and sort of expansion to really think about what does it mean to do healthy urban planning and to plan ahead for your populations. Now, Kathmandu is a little bit of an anomaly in this. They wanted to join us a bit later into the project because they were excited about some of the systems thinking work that we were doing. They're obviously a capital city, but they are still technically within that 1 to 4 million range, and obviously growing very rapidly. So, as I mentioned, this was a research and learning project. If you're familiar with USAID projects, there's very, very large ones that are really about scale and implementation. And then there's some of these smaller ones, like BHC, which is about 5 million US dollars, which is really about learning best practices and testing out and piloting some new approaches. So there was really a desire to learn more about how to approach urban health, which we switched around to say healthy urban planning, because we really thought that the best way to work on urban health is across multiple sectors, sort of across the social determinants. And so this allowed us to have quite a bit of breadth, but at the same time, you can imagine that can get very complicated quickly. So we use the systems thinking approach to help keep us grounded and have a way of continuing to check back with our city partners to keep us on track. We worked very closely with each of our city governments. In many cases, our staff were embedded in the office that we worked with. In all but Kathmandu, we worked with smart city mechanisms. We wanted to find a multi-sectoral office within the municipality that could become a home for this. So we were really thinking about sustainability from the start. And on previous work I've done around multi-sector partnerships, you don't want to have it just within one sector, because often there's rivalries that would make it so that one sector isn't really seen as a leader. So we wanted to have a existing office that had some multi-sectoral ambitions or ties already, and that the smart cities was a nice partnership in that way. And as I mentioned at the beginning, sort of my background, we're really thinking about the applied research side of this. So we are producing evidence, but we want it to be actionable. So it needs to be relevant and timely, and it has to be able to motivate stakeholders to actions that will be able to move the needle on some of these goals that the cities had. So we knew we were taking this sort of social determinants approach. We wanted to be able to use systems thinking. Many of us have a systems thinking background that started on this project. But as we got going, we really thought about, what are some of the requirements for being able to transfer this to the city government, the systems thinking approach to the city government. And one thing we needed was sort of a visual backbone, or a backbone that would allow us to sort of co-collaborate. Some of the requirements for this sort of backbone is that it must be able to address or include the complexity of a multi-sector system and include a wide range of stakeholders. And I'll talk about who we count as stakeholders a little further on. But the resulting tool must not be too complex itself in order for people to be able to understand it and interact with it. We really wanted to be able to create buy-in and real-time feedback throughout the process to support this data-driven learning and decision-making process. And I should say, just as with most USAID projects, we have a real focus on marginalized populations. So we are trying to move the whole system forward, but in particular, being able to bring in populations that maybe don't normally have a voice, or if they have a voice, it's not being listened to or responded to. And so these are sort of the main design requirements we had for how to sort of take the systems thinking from a theoretical framework and into sort of a practical decision-making tool. We interviewed quite a few partners and consultants trying to find a way to sort of take our theory into action. And we ended up working with a consultancy called Engaging Inquiry, who we really liked because they had made this a very participatory process, the mapping itself. And now I want, as many of you know, but just to clarify for those you don't, when I say systems thinking, it's sort of this umbrella approach. When we start to talk about the mapping, it is one tool that we've used within that systems thinking toolbox to be able to spread this in the cities that we're working in. So they have designed a systems mapping approach that's very participatory. It is, in fact, really just facilitated by us while the data is inputted and cleaned and interpreted by those in the local context that we've invited into the process. And we could talk about, who do you invite and how do you make it equitable? But that's sort of how they've set this up, and they've done it all over the world. They follow the same, primary steps that you might know from other systems mapping work: defining the context, figuring out leverage points and opportunities, and then prioritizing actions. So taking this forward, again, just to sort of summarize why this particular approach worked well for us, these maps were able to bring together people at the very beginning to define a common goal. And these are people from a wide range of sectors who might not speak the same jargon or language, from different levels of the city, grassroots up through, the highest levels, bringing in some people from the state and the national level. to be able to create a timely feedback loop between these different groups. It was also very useful to be able to set that agenda, not have us set the agenda. The local stakeholders are the ones setting that agenda. And then the results really are directly relevant to the policies or funding issues that they are tackling at that point or in this particular work plan cycle. It was very usable. There was a huge amount of information that went into these maps, and then that led to our action plans that we were able to implement from. But we found that this was a very friendly and adaptable format to be able to sort and process that information, even if you're not a researcher, even if you're not comfortable with sort of interactive tools. These maps were very useful. And of course, they're visually compelling. I'm sure many of you use Kumu as the software to process the maps, and I'm sure many of you have used this. It's compelling. It's not the only thing. It's not the endpoint that we were aiming for, but it was a useful tool. And I'll talk about some of the ways it's been used by the city government since the production of the maps. So as I say, that's the maps themselves are sort of the backbone. We did in BHC, we were learning about applying systems thinking at the same time as doing other programming. Some of it was systems thinking, some of it was really around addressing some of the backlog of needs that the cities had. But we were able to use those maps even retrospectively to sort of pull things back together and think about how does this actually fit into your overall goals as a city for healthy urban planning. So I'm going to use Indore, our first city, which was in India, first meaning the first one to come on board with us on BHC, to talk through these sort of other aspects of systems thinking and how it was applied in practice for this project. So I said I would get back to you about what do I mean by stakeholders. We, in general, on this project, on ARC, on a previous project I worked on, have thought about our stakeholder groups as sort of 6 main groupings. So government obviously is a very important one. Private sector is also quite important, particularly depending on the topic that you're working on. Donor and UN groups, you can sort of think as maybe the same. Sometimes they're different, though, if UN is operating more as a policy-making body rather than a sort of donor. Academia and civil society. We also then need to work across between 6 to 8 sectors in each of our cities. The city government and civil society folks were the primary drivers of who defined which sectors needed to be involved. But we've listed all of the ones that we've worked with across the 4 cities here, just to give you a sense of who had to be engaged for this healthy urban planning end goal. Most of the cities adapted their smart cities sort of goal statement or vision statement. And they tended to end up being something around improving the health and well-being of a city for everyone. So there was an equity aspect to their vision statement and an aspect of both health and well-being in what all of these cities were aiming for. Now, Kathmandu was another, again, a sort of a special case in that they were really focusing on operationalizing their national air quality action plan. So that was an example of using systems mapping to operationalize an existing plan or policy. But all of this is on our web page. I'm getting ahead of myself, but there's some really exciting outcomes that have come from using the systems mapping across these 4 contexts. But the point of this slide, and sort of to take this back to who is engaged, because it is at its base a participatory process. It is a locally led process. At the municipality level, these are the sectors and stakeholders involved. And I might shorthand as we go forward to say stakeholders, but it is the combination or the multiplication of stakeholders versus sectors. And then very much so the municipal and grassroots levels. Now, on BHC, we did engage state and national, but maybe not to the same extent that we will be on Asia Resilient Cities. And we can talk about more about this in the Q&A for municipal level action. Prior to doing the systems map, we had actually already worked to develop some multi-sector platforms within the government in each of our cities. So again, in the case of Indore, as one example, working through the CEO of the Smart Cities mechanism there, they decided to co-chair with the chief medical and health officer, who's sort of the senior health officer in the city, a smart health working group. Smart cities have been struggling to figure out how to spend their smart health funds. They wanted to be able to have this be a more expansive citywide engagement. And they had previously tried to bring together other sectors, but it ended up being more ad hoc. So supporting them with some of the sort of foundational documents and figuring out sort of the meeting structure and facilitating some of the meetings, we were able to help them set up a quarterly Smart Health Working Group across many different sectors, including some key partner NGOs and CSOs on that working group. And then again, sort of across the full portfolio of the project and leading up to and into and across the mapping work that we did, we had significant community engagement with some of these groups that were considered marginalized. And this was coming out of previous assessments we had done at the baseline to figure out who might be left out of regular communications with the city. This included the groups you see listed at the right. And again, I'll talk a little bit more about how we engage them as we go forward, but within a half hour, I can't give you all the detail. We did some really interesting work. So I encourage you to go to our website to see some of the participatory research we did outside of this particular sort of systems mapping, systems thinking track. So on top of building those platforms and those ways of working together, and sorry, one last thing on the multi-sector platforms, while there was no private sector representatives on the working group, I will give some examples of how the private sector ended up getting engaged through that platform once we had the action plan. Okay, so the next part of this is really spreading systems thinking. And so there was really some training and capacity building that needed to happen within the cadres that we worked with. So of course, within the systems mapping workshops, some of the practice that they were getting to do in the facilitated sessions to come up with the data to fill up maps was in its own way capacity building around systems mapping and systems thinking. We got a lot of interest and response coming out of those from different groups asking us for additional training, particularly with the ICCC, which is the Integrated Command and Control Center, the main data hub for data integration for smart cities in Indore. They asked us for training on Kumu and also around some other data integration aspects coming out of the systems mapping so that they could think about how to integrate the Kumu map, the systems map, and some of those modalities into their data dashboards. I'm going to stick with just the systems mapping first, but then I'll talk about some of these. So I'm going to switch these around a little bit. But the mission director of the Indian Smart Cities Mission, which is in India, smart cities are led by the national level. There's 100 cities that were selected out of many more who applied to be smart cities. And because of what we were doing in Indore and the feedback he was getting from the CEO, the mission director was actually very interested in use of systems thinking and asked for more national level trainings for city leadership. So the whole cadre of folks who end up cycling in and out of CEO positions across the 100 smart cities. This came near to the end of BHC. We did some webinars with them and some trainings with their core team, but now under ARC, we're actually going to be able to spread this approach and think about getting their staff capacitated to be able to then spread this further nationally across smart cities. And then finally, I'll talk about journey maps a little bit later. We have a lot of maps that we did. We need to come up with better names, but this is another modality of systems thinking. It really is a great way to get at the grassroots level, some of the key issues that you're seeing in the systems level and systems maps. And this was used in sentinel sort of neighborhoods across the city over every quarter. We'd come back and do these. And again, because of the interest of the community, from what was happening through the journey maps, they asked us to sort of train them on how to do this themselves, how to use this for advocacy. And so there was also sort of grassroots level training and capacitation around use of data, not just in journey maps. We did a lot of participatory research, and I'll give some more examples as we go forward. But really helping these communities start to figure out, this is their data. We made sure that they knew this was their data. It came to them first. They interpreted it. And then we helped them with the presentation of it to the key people in the city. But we wanted to sort of step out of that middleman role and allow them to actually continue to do that once we were gone. And so that's another part of the training that we did around sort of systems thinking and connecting our folks in the city. So here's a journey map. We, I get excited about this, and I know this is a new area, and people have not always talked about sort of a set of tools for systems thinking or applied systems thinking. what we got to play with on this project was all of these different ways of starting to try to figure out, how do we measure systems practice, systems thinking, and systems action. I don't know that we got to systems impact on BHC. There's a few things I think we could share with you that we started to do. We're working on how to figure out how to do that more with ARC. But this was a really fantastic tool for, again, as I say, sort of taking those 30,000 foot view patterns that we were seeing across sectors that were repeating and repeating and repeating, and taking it back down to the individual level and taking an individual view quarter after quarter of what was happening with a particular issue that was seen as either a frozen point or, you know, something, a pattern that we were seeing in that larger map, and getting that ground level view of what that meant for living and health and well-being in the city. So these are all on our website. And I'm happy to share the methods we used for these. I don't have time, unfortunately, to go into it right now, but this is one great tool that we had. We were also able to track flows of people and data and money across sectors. So that was one of the main ways that we tried to measure sort of the impact of this approach is, did you start to see greater integration across sectors on the issues that were being identified through the systems mapping and through the action plans? And so that's another level of measurement that we tried to use. We have yet another map, the partnerships map, which is also done in Kumu, but really looking at sort of the social networks that were being built, social human connections that were being made. And again, we're going to try to take that to the next level on ARC. But there was many tools that we tried to test out, and I think quite a few of them are quite useful for extending this sort of measurement of systems practice. So I keep mentioning this action plan. Okay, so coming out of the maps and the parallel pilot testing that we were doing on certain interventions, we wanted to develop an action plan that was something that, again, not ours. This isn't the BHC action plan. This was the city action plan that they were using to organize all of us, all of the people coming in to help them fund, plus their own money, toward these common goals, using that vision statement as a way to get there. So coming from the maps, we did the leveraging. We had our 3 leverage points for indoor. There was 3 to 5, depending on the city, that we considered sort of necessary but not sufficient for any action that was going to happen in the city, because they really were talking about sort of repeating patterns across the system. We then brought people back together for a group analysis with the same set of stakeholders to start to think about, what are some coherent actions? What are things that are across sectors just really mandatory to move us toward that goal for the city? And then from there, we went back to our context map, looked at sort of the flows of obstacles and opportunities, and the sort of, we had these hemispheres, we couldn't think of a better word for it. I'm sure there's a better way to say it, but sort of the groupings of issues or loops that we were seeing in that context map, to make sure that we didn't miss anything. And so cross-referencing what came out of the participatory side of this with the sort of on paper data side of this, and what we were seeing from some of our other research, to create a set of coherent actions that then had very concrete sub-actions that could be broken down by sector. And I want to kind of make this point as I go into this slide. So we ended up with 7 coherent actions for indoor. They are, I couldn't have made these up. They did such a good job of really connecting the dots on some of the things across sectors that were really necessary for this particular city. But I have worked on multi-sector planning for 20 years, and you can have the most beautiful multi-sector plan, and no one is going to implement it unless you break it back down to the sector level, so that people can take it back to their boss or to their planning office and say, I need this, it's going to cost this much, and I need it for this many years. So while this is a great example of what systems thinking can produce in terms of policy, you have to then take those additional steps. And so that's what the sort of healthy city action plans do. They have these, they explain where they come from, the impetus and sort of the motivation that people should have, but then breaking them back down into very specific sector actions, which we then costed with the government and with the partners who work in those sectors. And then also co-created a monitoring and evaluation framework for them to be able to follow up on the progress of these actions. And what I like about this story is not that we created a beautiful 30-page action plan with all of this data in it. I like that stuff, but it doesn't matter to people on the ground. What I like about it is that before we even published this with the government stamp on it and handed it off to the government, they had a year before this even came out, it was already getting integrated into people's work plans because they were in the meeting. They were the ones who just defined this stuff, right? So in the participatory workshops, they were getting these ideas from each other and from, even giving themselves credit that they, because they were in this facilitated workshop where they got to work with people they maybe don't get to work with on a day-to-day basis, they came up with a new way to look at what they're doing. And they were also able to say, well, oh gosh, this partner's just said they're going to fund this for $1 million. All we need to do is provide the infrastructure. And so in not just indoor, and in 3 of our 4 cities, before we got to the publication of this action plan, they were already putting into their work plans. They asked us to come in Makassar in particular, to help them put this into their 5-year work plan. So we had to scramble, this document waited while we got the information they needed from the outputs of these workshops into their actual budgeted work plan. So that, I think, was a big success for us. The systems mapping and the action plan process ended at about year 4 for most of our cities. So we only had about a year left to be able to pilot the actual action plan itself. Now, again, I said in the previous slide, people were already piloting many different parts of this, but trying to get a sense of how a coherent action could be implemented. Because again, even though you've broken down the funding and the approvals by sector, you still have to get people back together to actually work together in the application. So I really want to just quickly share this piloting that we did called Kayakalp. Kayakalp translates to rejuvenation. And what had come out of some cross-city study tours we had done is that, in our Indonesian city, they had done these healthy alleys where they sort of rejuvenated these lower income. They're not quite, alleys in Indonesia aren't quite informal settlements, but they're sort of could be considered equivalent in size and population to some of the informal settlements that Indore had. And so there was this desire to do something like this where you're doing area-based development by these smaller communities, but we weren't able to figure out how to operationalize it until we had the action plan. And in parallel, I alluded to the fact that we've done participatory research with several of these neighborhoods. So there was one particular participatory survey that we had done in 8 informal settlements. We were able to get agreement from the CEO to pilot the Kayakalp, the action plan, in 2 of those settlements. And so what happened is we came back to the neighborhoods and did these data walks. So we had our action plan, we had the data that these folks had collected and helped interpret around environmental health and some of the structural issues. And then combining those two aspects, they were able to prioritize what from that action plan did they need the most? What were their key, what were the really key intervention points for them? Because if you think about this as in terms of an equity-based approach, you cannot apply all these actions at the same level in every neighborhood in the city, both for resource constraints and because not everyone needs them. So this way that the community themselves were able to say, looking at their own data, well, we need this the most and we need it this way. So they really took that action plan and made it their own for their community. And through a local CSO basics, we were able to implement major changes in these neighborhoods, including the revitalization, in some cases, rebuilding of their Anganwadi centers, which are child's community centers, creating safe, clean places for the kids to play. So a lot of the aspects of child-friendly cities were important for the 2 communities that we worked with. We helped the city identify 200,000 square feet of unused or sort of vacant lots that could be converted into green spaces for both adults and children to get more physical exercise. We helped them with 9 kilometers of sidewalks and bicycle paths to connect these neighborhoods to public transport. So these were some of the priorities that were given within these data walks. So this was really a fantastic opportunity to test this out. And one of the things I like about this too is that based on the test, the city was very happy with it. We were leaving, but there was another USAID project in Indore, Samagra, who was continuing to operate. And based on the strength of this test and the fact that Samagra was involved in the systems mapping this whole time, they were ready to jump in and implement in the remaining 5 neighborhoods. One of the neighborhoods actually got evicted and is no longer there of the original 8. But the remaining 5, Samagra put in $50,000 of their own money to work with the city to do this kayak haul pilot in those other neighborhoods. So I think that's a really good example of how by planning together, even once one partner has to leave, and invariably someone's going to not be there, or the money might not be there, having somebody else who can jump in and have the justification already done for why they should be operating in this space. It made a huge difference. So I'm going to wrap up on BHC here. So this is, we did these great interactive infographics. There's a link, you'll get these slides, I'm sure, and the link under Indore will take you to the thing link, which you can click on each one of these bubbles and get to see what we did in these areas. Because we're an integrated project, I'm not claiming that our project did all of this. I think I've described sort of how we've laid the groundwork and then how we work together with the city in a lot of these areas, but this is where the map took us. So this is a way, a lot of people we've worked with have looked at this and said, God, how did you keep track of this? How did this not become a huge, especially with, we were 5 million globally. So each city got less than 1 million. But it's because of the systems thinking that we were able to keep this connected to an end goal and be able to keep going back to the maps every quarter or every year to say, are we still on track? Are what we were planning to do, is that connected to what we're seeing in the map and ways to get to our end goal? So I encourage you to go to our website and check out. We have got one of these for each of our cities. So as I'm wrapping up here, I just wanted to take us to the next step. So as I said, BHC was a really great place to test whether we can do this. How can we apply systems thinking and make it a very practical approach? Now we have another 5 years to work, again, through the Asia Bureau, to think about refining this approach. So we're now moving from a focus on healthy urban planning to resilient urban systems. And within resilience, healthy urban planning has a place. Health is one of the areas we consider, but we're now thinking sort of at the larger level, how do you help cities not just absorb or mitigate shocks from climate, but really adapt and transform their systems to be optimized for what they're facing. And so we are actually starting ARC with rapid co-creation using, again, that visual backbone of the systems maps to create a joint work plan from the start of the project. We are deep in the throes of getting all of our MOUs signed with city governments. We're very close to being able to announce our first 2 cities, and the next 2 will come shortly after that. We gave Engaging Inquiry, who we're working with again, the design challenge of doing this in 3 months. It's tight. It's a tight, if you've done systems mapping, especially in a participatory sense, when you have multiple subgroups of marginalized populations that you also need to socialize with. It's a tight timeline, but I think we're going to be able to do it. And then what we're also doing is building in more formally into our project cycle that every quarter we are doing a revise and adapt of the maps as our new evidence comes in. And every year with the city government built into their budget and work planning cycle, we will be doing a revise and adapt with them, since the joint work plan is really driven by their goals in this area. So we're really excited to take this to the next level and work even further. As I said, there's extensions we want to make around how we're measuring partnerships, how we're measuring systems impact, starting to look at the overlap between resilience and systems change measurement. So I think there's gonna be a lot more we can share once we get going with ARC. But anyway, I'll stop there, and I hope this was interesting, and I'm happy to answer any other questions you may have.
Wow, thank you, Amanda. And spot on time as well. Amazing. It's almost like I know that you did practice there as well. So no, excellent. I've got And I've made notes of so many questions. I could probably just fill up the 15 minutes myself, but I shan't do that. I will put a pin in my own questions and go to the audience. Rika has already got in there and started to ask questions already, but please do post the questions that you might have into the chat. And we'll put them forward to Amanda. If we don't get a chance to answer all of the questions, we will also kind of follow up in the Cities Hub space. Amanda has access there too, so if you've got any questions specifically for her, I'm sure she'll be able to kind of respond there too. But there's a question that Rika asked that it sounded very kind of similar to one that I wrote down, which was about kind of the different and potentially kind of quite divergent motivations, needs, and commitments from the multiple stakeholders involved. How did you navigate that? How did you kind of get all those stakeholders ultimately on the same page and pulling in the same direction?
Yeah, it's a great question. And let me start with sort of the various different factions within government and the donor partners, since they tend to work more closely together. This is why we wanted to work through a government office that already had some goals in this area. We're trying to do this again with Asia Resilient Cities. If you're coming in as a USAID funded project and you're trying to get everybody aligned behind your common goal, it either isn't going to happen, or it's going to be a Herculean effort, and it might fall apart as soon as you leave. If we're building up momentum behind something that the government's already trying to do through smart cities, or their disaster resilience office, or through the mayor's coalition for climate change response, whatever happens to be that multi-sector convener that the city's already trying to build, it is a much easier task. If the mayor is calling people to arms around sort of a common goal, it is much more sustainable. Maybe not the mayor, depending on your context. I don't know how often mayors get kicked out. Certain countries, maybe that's not the best example, but some senior level, might be the municipal commissioner in terms of India, who is calling people to order around sort of a common goal. Now, there will still be negotiations, but we want them to negotiate with each other and not have, we don't have a dog in the fight really, as long as it's sort of taking them toward a common goal, either on healthy urban planning for BHC or for resilience on ARC. And donors tend to want to align with government these days, at least where we're working. So if you can make that case that this is really driven by the government and not by us, it's a lot easier. Now, private sector has been much trickier. And part of this is because they just don't talk about things in the same way. This is true when I was working in nutrition. It's true when I'm now working, in urban health and resilience. The motivation for a private sector organization to engage is going to be really around a business case. And so you have to be able to really change the language. And I don't know that it is as effective to have them in the room for these group facilitated meetings. They tend to want to have a separate conversation. So if you can set up the government with the information they need in the format that they need it to make that case to the private sector, that tends to be more effective, sort of single channel discussion versus group facilitation. They don't tend to see it as a good use of their time. The one success, we had a few small successes with private sector. The one bigger success we had with them was actually through the Confederation of Indian Industry. And they had been working for a while to figure out a way to support, the air pollution was a big issue in Indore. And so we ended up doing a large participatory research study around placement of low-cost air sensors and clean air guides. So human and tech in 20 different neighborhoods. And I won't go into the details. It's online. It's great. It was one of our I was really excited by this. Anyway, it excited more than just me. The CEO and the municipal commissioner got really excited about it. They are now funding a cadre of what they call Clean Air Champions. And they were able, through, sort of negotiation with us and on the basis of the work we did, bring in this Confederation of Indian Industry to spread this. They've added additional 50 sensors, and will be supporting additional neighborhoods out where their factories tend to be in the industrial side of town. So there was a good reason for them to engage, because it affects their workers and their industry, but we were able to find that common goal for them. So anyway, I'll stop there.
So definitely kind of facilitating that journey of identifying those kind of commonalities rather than focusing on the kind of differences and getting people excited about those. Great. Which leads a little bit to another question that Rika asked, was around what do you feel, what do you understand as the strongest element to take forward for city collaboration? So how do you, from your learning, I suppose, and from your examples that you've given within the project with BHC and moving into ARC, what is that key element around city collaboration that you are learning needs to kind of be replicated or reproduced in some way going forward? Yeah.
I mean, I could talk about multi-sector platforms for days, but I think I've covered that. I think one thing I didn't talk so much about, but is very important, is around that citizen engagement piece. So many cities will have citizen reporting systems, whether it's for a sector to, say it's the energy sector, people can report when they have a brownout or have no power. But that system is not useful if it is not providing feedback back to the people about when they're going to get that service back, or if it's not responding to a certain subset of people, or is not accessible to a certain subset of people. So a lot of these smart cities love their smartphones, and they'll have all these apps that people can report garbage on the streets or traffic block, anything. Again, sort of thinking about across that, what does it take to make a city livable and improve well-being? That's often what these smart cities are aiming at, but only people with smartphones can tap into these in some cases. And it might not be that it's because people don't have a smartphone, but they might not want to use it for that case. We actually did some very interesting market research on this. And again, I encourage you to go to the website for it. But I think, making sure that every population in a city has a way to not only feel comfortable to send a message about an issue, but receive feedback, changes the way the city thinks about how they plan. It's a very simple thing, but it is incredibly important to thinking about holistic and sustainable urban growth, both for the health side of things, but also sort of sustainable economic growth, which is something we're going to be looking at more intensively on ARC. So I would say that is another key aspect that all projects working in this area should really be considering as they go forward.
So definitely about kind of thinking about the multi-channel opportunity for participation, not just driving it through technology, and also about it being a relationship and communicating. It's not just one way. Kind of the data flow is that actually there's feedback within that system for citizens. That's super interesting. Thank you. Which leads a little bit into Anya's question, which she was saying about how did you approach gathering that data from those hard to reach groups, those marginalized kind of communities that you've already said didn't necessarily have a say or weren't empowered to really kind of contribute historically. So yeah, how did you approach kind of engaging with them and giving them that power?
Yeah, so we had a couple different ways to do this. Specific to the mapping, we tried to work through local CSOs who had a trusted relationship in some of these communities, and asked them to sort of help us facilitate the meetings and discussions. Outside of the mapping, we, again, through local partners, this is a big part of, especially now with USAID, but particularly in our approach, we wanted to work through local CSOs who have been there for decades. Even our implementing partners in each city, we try to pick folks who are well embedded in that community, that city, that municipality, so that we're not coming in as a foreign entity when we're asking for these conversations. Now, I told you I'm an economist. I love my surveys. I love the data. But we're really missing something in the way that we were collecting it traditionally when we're trying to reach these groups. And so participatory research is really something we're trying to develop and evolve. It's not perfect in the way it's been applied previously. In fact, even with BHC, we learned over sort of the 3 participatory surveys that we did that traditionally with participatory research, you're asking the community to help enumerate or collect the data. I don't actually think that's the best place to engage, both for privacy reasons and for data quality reasons. But engaging them in the design of the survey tools, or whether you're doing qualitative or quantitative, in the tools, in the questions that really need to be asked, and then bringing it back to them first before anyone else, and having them help interpret the data, both to make sure that it's valid and to say, what does this actually mean? How are we interpreting what we're seeing here? That's an incredibly important part of this. And it blew me away. I mean, I get like misty talking about this, but in both India and in Indonesia, we did these studies in more informal areas. And they said, this is the first, we have been surveyed so many times, this is the first time anyone has come back to us to share the data. I mean, especially in the day and age that we're in, where we know the value of personal data, it's kind of mind-blowing that that's the case. So I'm totally converted. This is something we're going to explore and expand on ARC, and I'm talking to other projects in JSI and how we can sort of think about revising even our standard academic sort of IRB processes to better include really defined benefits to those who are sharing their data, particularly marginalized populations, and figuring out, when do we share those data with them? Because it has to be shared at some point. It really should be. Anyway, and then finally, going back to those journey maps, that was a trust building exercise as well. We've written a paper on this. It's, there's definitely ways that you can do it wrong. There's ways you can do it right. There's a lot of ways you can do it right. But I think what we liked about it is that we, again, were sort of active. We would ask questions of the community about this particular issue. Then we'd go ask the people who were supposed to be providing that service to them. And we weren't leading them, but just by asking those questions and sharing back some of the information we were hearing from community members every quarter, it got things to move, and it started more of a conversation with that community. So the communities really saw the value in it, and that's another reason they asked us to sort of share the tool with them and have them be able to keep using it.
Right. Because nobody else has posted one, I'm going to ask one of my questions just to wrap it up. And it's so apologies if it's going to kind of run over a little bit from the next couple of minutes, but I was really fascinated by what you're trying to address is quite a complex issue around urban health anyway, and adding kind of multiple stakeholders, including communities, marginalized groups. It adds to that complexity within the problem space. So why did you feel that kind of that co-creation kind of and collaborative kind of method or process was the right one for you in this project? And then also at the other end of the scale is kind of the impact you mentioned about kind of systems impact is still something which is emerging and we've not quite captured it in total, but I was quite curious as to whether there's any trends or any indicators as to the potential impact of that process of co-production and collaborating with those multiple stakeholders.
Okay, so the first question is about why did we choose this more difficult?
Yeah.
And I have to say, so yeah, it can be difficult, but it's sort of you're choosing where the difficulty is. I had worked in think tanks and research organizations before coming into sort of the NGO world. And we would do these beautiful, perfectly done studies, and then it would take 2 years, or maybe it's never got picked up for policy. It would take an incredible amount of time to sell someone on something you created in your own bubble. And most of the time it just sits on the shelf, and it really bothered me. And so, once I joined JSI, I did this very large study on multi-sector nutrition financing and governance. And again, we were collecting it And then it took a lot of time on the back end, a huge amount of time on the back end for people to actually buy in and care about the results and try to use them in any way. And by that time, the data were out of date. So in my mind, yes, the lift is much harder on the front end with this participatory type of approach, but for the purposes that we are using it for, to influence policy, governance, and financing, to create more sort of systemic change, I don't know that the time is any longer. It's just where you're spending your effort. And so the effort more is on the front end rather than on the back end. And then the second, you might have to repeat the second part of that question.
Was therefore through that process is what are you identifying as maybe some elements of kind of systems impact? What's the result of going through that as a process? And I'm hoping that kind of indicates why it was worthwhile doing it that way, because you actually, you've already indicated that you've got more active people, you've got people who are actually owning it and taking responsibility, and it's not a passive kind of result. But yeah, I was wondering whether there was any other impacts you could share with us.
Yeah. So like I say, the ones that I'm most confident on are sort of around creation of, I don't know if it's networks or connectivity between people, money, and data. That really has been the areas where we're seeing the biggest, I don't know if it's bang for the buck, but that's, if you're able to sort of create sustained, meaningful, multi-sector, multi-level participation and collaboration across people, data systems, and funding, you tend to get a much bigger bang on the actual, if not implementation, then at least the creation and the launch of sort of systemic action. What we don't have yet is does that actually get implemented, and what happens between sort of the launch of it and the application of it? Because again, things end up happening sectorally, so it is hard to keep people connected. And so are there different levels where we have to continue to do that sort of connectivity all the way down to the bottom, so that the activity in the end is changing the system? Or does it start to fragment? Well, so does it start to fragment as you go down to the point at which you're implementing, if you don't have those levels of connectivity all the way down? Or can you drive this from the municipal level alone? And so I think I know the answer, but we're going to try to test this out a bit more on ARC. Yeah, but I'm very open if anybody else is working on measurement of systems impact, particularly, now that we're moving into resilience, there's a lot of overlap with sort of building resilience and improving systems or strengthening systems, the capacity of systems. We're working from the BIGS framework, which is I think it's the Resilience Alliance, and I think the Stockholm Resilience Center maybe is now the housing of this framework, but there's a lot of overlap in what we're seeing there and what we're seeing from our systems work. And so I welcome any inputs that people have on measurement of these ideas.
Great. Well, it sounds like a call to action we can definitely post into the chat. There was a question that came in from Eduardo, but apologies, Eduardo, we've run out of time by me jumping in and asking my long-winded question. So what I'll do, Eduardo, is post that into the SI Cities Hub chat for everybody to kind of respond to, and hopefully Amanda will be able to pick it up there and share her knowledge and insight. So a huge thank you, especially to Amanda, but for everybody else joining us today. I've found it fascinating to hear about this as a project, and also the iteration into the next phase. So a huge thank you from me. If you would like to say thank you to Amanda, please do so in the chat. And also, please do let us know your key takeaways from today. What is it that you've kind of felt motivated by, inspired by, or anything that you've kind of really taken from today's discussion, and seeking to apply it into your own work or elsewhere? It'd be lovely to hear what your takeaways are from today as well.
Yeah, and just one last thing, Lauren is just reminding me to say, you can sign up for our ARC newsletter if you're interested in following the project and how we're going, and I'll paste it into the chat now if any of you want to sign up.
Great. Thank you, Amanda. Yeah, the front end versus back end. Yeah, that was a really great insight. Thanks, Wen. Great. As you say goodbye, I hope you will enjoy the rest of your day and afternoon, evening, whatever time it is where you are in the world. Do look after yourselves, and we'll see you all again soon.